it's World Mental Health Day. So kind of tell me, what does this day mean to you?
Well, World Mental Health Day is really an opportunity for us to remember to stop and bring awareness to mental health and talk about it, normalize the conversation, especially when it comes to children's mental health. I think we often think about mental health and we think of adults, but we know that half of lifetime mental illness starts by the age of 14. So it's really important that we're having conversations about children's mental health.
And when it comes to, mental health, Honor Sleeves was founded 5 years ago. What prompted its formation in all those years?
Yes, so 5 years ago, we launched On Our Sleeves. And the goal then in 2018, pre pandemic times, was to bring awareness to children's mental health, to awareness that 1 in 5 kids are living with a mental health diagnosis, and that it's really something that we should be talking about and breaking stigmas around. Of course, since our launch, a lot has changed. We lived through the pandemic. I think a lot of people realize how important this conversation is. And so on Our Sleeves now has turned into an organization that's giving these free resources to help promote and build understanding of children's mental health.
And how has children's mental health changed over the last 5 years?
Well, it's interesting because even before the pandemic, we were already seeing alarming trends in children's mental health, and then the pandemic exacerbated those things. I think some of the things that have changed is that, again, there's more awareness to children's mental health. Like people are aware that kids do have emotions, they can have a hard time. And so I think parents, teachers, adults are seeking out answers of how do I support children? How do I talk about mental health with them? And really seeking out the resources that we're providing, which is why I think we've been so successful in launching here locally, but reaching all 50 states, reaching 11 million people since 2018 is because I do think people are seeking out these resources now.
And, how has Honor Sleeves evolved over the years when it comes to children's mental health?
On Our Sleeves has evolved in that we're really focused on this idea of the upstream approach. We don't just want to wait for a mental health concern to show up in a child. We don't just want to wait for a crisis. We really want to think about what are those habits, behaviors, relationships we want to build in children that help protect them, that help promote their mental wellness. Just like we promote their healthy eating and exercise for their physical health, we want to do the same thing for their mental health.
And, when it comes to helping kids with their mental health, are there resources that families can take advantage of right now through Honor Sleeves?
Yes, so at honoursleeves.org, all of our resources are free. We talk about almost 500 different topics that are all related to children's mental health, understanding it, promoting it. People can go on right now and find those resources. They can sign up for our weekly listserv where we share a new resource each week. And then, of course, follow us on social media to stay updated.
And, what is your message to families, especially for today being World Mental Health Day?
My hope for today, for World Mental Health Day and every day, is that we realize that mental health is a daily thing that we should be thinking about, especially in our children. Again, what are the ways we can promote wellness in them? What are those purposeful habits we can have as families or in schools, communities to build the mental wellness of children? That we don't just wait until we're worried, but we're talking about it from the day they're born.
And are there any, specific goals or changes for Honor Sleeves that you would like to see in the future?
My goal for On Our Sleeves is that people know to turn to us. We are evidence informed resources. We have the experts at Nationwide Children's Hospital behind us. Everything we put out is based on science, the things we know help children. And so I hope that people continue to see us as their trusted resource and really turning to us when they're trying to figure out just how to raise children, how to respond to their behaviors, how to talk to them, those day-to-day things that can be tough as parents and teachers.